In today's video, we're going to be going over a case of acute diverticulitis on CT exam, and we're also going to have two quiz questions at the end of the video. So we'll start off with our acute diverticulitis case. This is a CT abdomen and pelvis with portal venous phase intravenous contrast. So the first thing I'm going to do is just take a quick scan through the case and look for any obvious abnormality. And then I'll come back to the top and start my search pattern. First, looking at the liver, at the right hepatic lobe and the left hepatic lobe. This is right in radiology and this is left, just to remind you. And there is a small focus of hypoattenuation along the fissure for the falciform ligament. This is a very common finding and is most compatible with focal fatty infiltrate. In a patient who has a history of malignancy or maybe a predisposing condition for hepatic masses, some radiologists may recommend further imaging to definitively characterize the lesion as focal fatty infiltrate or something more suspicious. Then we move to the spleen, which looks normal. We look for the pancreas, we look for the pancreatic tail and the splenic hilum, and we follow it towards the midline, and it looks normal. And we can see here the extra hepatic common duct coming up towards where the gallbladder would normally be, but here we see cholecystectomy clips in a patient who's had her gallbladder surgically removed. We're going to look at the adrenal glands, and we see them here, these inverted Y's or inverted V's sitting above the kidneys, and the right looks normal and the left is also normal. We're going to move on to the kidneys, looking on the right, and the parenchymal tissue of the kidney itself looks normal, but we do see these calculi, these little renal stones sitting in the renal calyces. However, there's no evidence of obstruction. We'll look at the left side. And we could say that the left kidney is slightly atrophied, especially the inferior pole compared to the right. We'll look at the collecting systems, so no evidence of obstructive uropathy. The calyces are nice and thin, the pelvis is normal in size. We'll follow the ureters down, following the left down. And it is normal. We'll follow the right up. We can see the uretrovesicular junction over here, and we can follow the right ureter up. Sometimes it's a little hard to follow at this point, but we can see it coming up over here. And there's no abnormal dilation, so that's normal. We'll take a look at the bladder, and here it's distended with urine and otherwise normal in appearance. This is a female patient, so we'll look for the uterus and the adnexa. The uterus is surgically absent in this case. We'll look for any abnormal adnexal mass, and we can see here is the right ovary, and it's pretty normal in appearance. And then the left ovary, a little difficult to see, but we can say confidently that there is no abnormal left adnexal mass. Sometimes if you have difficulty locating the ovaries, you can follow the ovarian veins. So here, if you can see here, these are some of your right ovarian veins, and you can follow them down towards the right ovary over here. So we'll come back up top and we'll start our evaluation of the gastrointestinal system. And so here we can see our distal esophagus with a small hiatal hernia. Look through the stomach, which looks normal. Here's our duodenum, the first portion, the second portion, third portion, and the fourth portion. We're going to evaluate the small bowel generally by just evaluating the left side of the abdomen. And the small bowel itself looks pretty good. There is this short focal segment that is fluid filled, a little abnormal compared to the density of the rest of the small bowel, and we'll look on the right. And again, a little bit more fluid filled small bowel, not particularly abnormal, but given all these inflammatory changes, it might be related. So small bowel is possibly with some reactive change. And we'll follow the large bowel, starting with the rectum, going to the sigmoid. We see numerous tiny little colonic diverticula over here, these tiny little outpouchings of large bowel. And then over here, we see a segment of large bowel that has some bowel wall thickening. Here you can see that the bowel wall is nice and thin. If we compare it to up here, the bowel wall is thickened. We see lots of inflammatory changes in the mesenteric fat. This is normal fat density. This is congested, inflamed fat. We see increased vascularity. All these little linear streaks are vessels. And then we see this small focal collection that appears to have fluid density. It is not obviously with a enhancing rim. It looks like a little bit of organizing fluid, possibly along the wall or within the wall of the large bowel. We'll follow the rest of the large bowel, and again, we see lots of diverticula. We're at the splenic flexure, transverse colon. Again, we can see how thin the wall is normally. And we're going to come up to the hepatic flexure colon and work our way down the ascending colon. It's questionable if maybe there's a little bit of thickened wall here, but this may just be due to peristalsis and volume averaging. We don't have the coronal and sagittals to better evaluate, but there are no associated inflammatory changes. The fat around this is very clean. Here we can see the ileocecal valve, the terminal ileum, and we'll look for the appendix, and here it is. This little blind ending tubular structure coming off the cecum, and this little tiny bright dot, that is a tiny appendiculith, a small stone. It is not obstructing the appendix. The appendix is normal in size. We'll look for any free fluid or air within the abdomen. There's no free fluid. It's typically a good idea to change the window to better appreciate smaller amounts of free air. I'm not able to do this on this exam, but that's typically what you would do, and I don't see any free air here. So next we're going to move on and evaluate the vasculature. And we have our hepatic veins, our right, middle, and left, our portal vein, the right and the left, and our main portal vein, our splenic vein, and our superior mesenteric vein, and they all look good. We'll come back up top and evaluate the aorta. So here's the aorta. Here's our celiac vein, a little bit of calcified atherosclerotic plaque here, our superior mesenteric artery, our renal artery origins, and the inferior mesenteric artery origin. The aorta is normal in caliber. There is no significant stenosis. We're going to follow the vessels out here, at the same time looking for any iliac chain lymphadenopathy, and there's none. We'll do the same on the other side. and the vessels look pretty good. Also, no lymphadenopathy. Look posteriorly, and we don't see any lymphadenopathy. We're going to look along the aorta and the inferior vena cava, again for any abnormal lymph nodes. Here we see a few, but these are not pathologically enlarged by size criteria. Typically, we use 1 centimeter as cutoff for pathologically enlarged. This changes depending on what part of the body you're looking at, though. So the vessels look pretty good. Again, I can't change the windows here, but I would normally evaluate the lung bases. The heart looks pretty good. It's not obviously enlarged. We look at the superficial subcutaneous tissues, and here we can see 2 breast implants. We'll look anteriorly, and no significant abnormality. And then we'll look along the lateral sides of the pelvis, looking at the subcutaneous fat and the musculature, and that's within normal limits. And we'll look posteriorly, again, the subcutaneous fat, the musculature, and also evaluating the spinal canal and nerve foramina for any obvious abnormality. And then again, I would change this into bone window and evaluate the bones again, but I can't change the windows on this, so I'm not going to show that. So overall, we have a couple incidental findings. We have some non-obstructive nephrolithiasis. We have a tiny appendicolith, but our major finding here is this acute diverticulitis involving the sigmoid colon with a little bit of fluid here that appears to be organizing, and you could call this a phlegmonous collection or perhaps an early developing abscess. So that's acute diverticulitis. So we're done with this case. We'll move on to our quiz questions. And the first quiz is 2 images. This is the first image, sorry. And this is the second image. So if you can tell me the name of the sign, just leave it in the comments below and I'll let you know if you're right. That's our first question. Our second question are these MRI images of the cervical spine. These are T2 weighted images. You can see that the cerebrospinal fluid, or the CSF, is bright. So this is a T2 image. Our first image on the on the left, is in neutral position, and our image on the right is in a flexed position. If you know the name of this disease, then comment below, and again, I'll let you know if you're right. Those are our 2 quiz questions. If you like the video, give it a thumbs up, and if you like these videos in general, you like the channel, then subscribe. Thanks.